Good afternoon and good morning, everyone. Thank you all for joining us today. I'm Jenny Jenkins, and I'm the Executive Director for Global Healthcare Resources. I'm here today to bring you the next generation of self-funding for employers with our partner at IOA, Preferred Partners, USRX Care, Remedy One, Stealth, and Script Sourcing. So we're really excited to be bringing this to you. And on behalf of all of our partners here, we want you to know that this was fun to put together. We've got a lot of content to cover, and so stay tuned because there's a lot that will be coming up. So before I jump into it, I want to introduce the person that helped us put this A team of speakers and players together. Matt Williamson, he's Vice President for IOA, and he's going to talk to you a little bit about what he does and a little bit about how he kind of leads the self-funding market as an advisor for employers. And then we'll jump right into the event. And please note, for little housekeeping notes, that you can ask questions at any time. All you have to do is simply look up in the top right corner and you'll see a Q&A section. There, if you populate your questions as we go, at the end of every segment, we'll take some time to answer those questions. The goal, of course, is to make sure that you get as much information as you can in this first of 4 series of summits that we'll be hosting. So stay tuned. We also have one person that's going to win one of our certification programs worth $1,000. And we're just really excited to bring all these high-level players to the table. So without further ado, thank you for being here, and I'm going to pass it right over to Matt.
Thank you so much, Jenny. My wife last year went to get a routine mammogram from her OB/GYN's office, just like she does every year. She doesn't like to hear me complain, because I'm always saying, honey, you need to go do this, you need to go do that. So she actually made it on herself, and I was so proud of her. So she went and had her mammogram done, and surprisingly, we still have a phone at the house. We received a message the next day from her OB/GYN, and they said they'd like us to call. So we called, and they said that they found a small mass. There was nothing to be worried about, but they would like for her to go get a sonogram, and it was on her right breast. So we talked about it, and we didn't really strike that much concern within the family. But after she had her sonogram, they told us that we needed to come in and get a biopsy about the small spot in question. So we sat down with the surgeon, the radiologist, the oncologist, and that's when the reality hit. And our biggest fear had come true, that my wife was early stages with breast cancer. So my wife of 19 years, 48 years old, now had a breast cancer and became a statistic. She would then have the surgery and 20 days of radiation. From this moment, I was no longer a consultant selling healthcare. I was just an employee who was thrown into the depths of these unknown turbulent waters of healthcare. And I was just like everybody else out there with questions, and the bills started flowing. And next thing I knew, we were receiving a bunch of letters from genomic testing, and medication started piling up. I was drowning. I didn't know what to do. So, and I do this for a living. And my wife's looking at me saying, honey, how this is what you do for a living? Like, how can we have these concerns? These are the concerns that everybody you're dealing with has. You know, why is this all happening? Where's our advocate? Where's our carrier? Have you called my doctor's office? So my name's Matt Williamson. I'm from Insurance Office of America. I've been here for 15 years, and it then became my passion, more so than before. I took it personally, and I want to try to make the industry better. And after this situation, I took a long look at processes and programs that are available to employers and also for the employees, and decided to take this word transparency to a whole new level. I mean, I want to lift the hood up and let everybody see what the engine looks like. So this session is going to be more about the critical need for transparency in the healthcare industry, and for consumers and users to be able to make the best decisions possible based on the criteria and the information that we are able to provide for everybody. And ultimately, this will help us live healthier lives as a result. So on this webinar, we did find some great folks that are in the industry who are taking transparency to a new level. And if you're looking for innovation, you have definitely come to the right place. I'm so excited to introduce all of them. I mean, these folks are they haven't even started printing what these folks are going to be able to talk about and the savings and what they're doing for the employees in the marketplace. So I have so many people ask me now, with clients and with prospects, and they ask me, what do you do? What makes you so much different? And I heard an analogy, and I want to let everybody know what it is. And I refer to golf. And I explain my role as a caddy, and it's for me to as in looking at my clients and my prospects as the golfer, and we walk foot to foot the whole way through the entire course. Every hole takes on as a process or a situation the one that we're being played. The clubs which I carry for my golfer or client or employee or whoever that may be represent the ideas or solutions in the golf bag. So we have a shot to the pin. It's my job to say, here's the slope, here's the distance, there's wind. This is the suggestion I think you should utilize. And for my client or the employer, whoever, like I said, we're working with, it's their decision on which one that they like and which one they want to go with. We ultimately provide all the information to make it positive and make that shot the best shot we can make. And then once we finish that hole, we go to the next process or the next hole. But the whole time we are walking hand in hand, foot to foot, walking through this, golf course that we are doing together, which is healthcare. And it is very difficult. And, there are going to be some weather situations that come, and we hold the umbrella for the golfer, and we hold the hand of the client or the prospect. My team that I have surrounded myself with is second to none. We are fantastic. Here at IOA, we are so nimble. We don't have all the layers of the onion, which allow us to be very innovative. And so when our team or somebody in our organization finds something that's innovative, they immediately bring it to our board, of which I sit on, and I have been on for 7 years. So because of these different, being nimble and these different things that we can do on the turn of a dime, we're able to do some very innovative things. So, but the great news about all this in my story is that last week we did get results from my wife's blood work after the radiation and everything, and she is cancer-free now. So it was a fantastic day. She still has to have surgery on September 16th to remove the ovaries, but it's a preventive measure. Everybody's in great spirits. So with that, I'd like to turn it back over to Jenny, and we look forward to talking with everybody. If you have any questions or comments, we'll circle back at the end. We look forward to having everybody engaged and helping in any manner we can for everybody. Thanks, Jenny.
Thank you so much, Matt, and thanks for sharing that story. I think all of us have, at one time or another, been through something that has tested our strengths and given us our, ability to do what we need to do. And so thank you for sharing that. Before I introduce our next speaker, I wanted to let you all know that we want to hear from you. And so we've got a couple of polling questions that we'll ask during the event. And then, of course, Matt mentioned, please go ahead and definitely answer or ask questions there in the area that I mentioned. So first polling question, are you currently self-funded? Yes or no? First polling question, Sid. And give us a second here. And here's our poll. We'll have about 20 seconds. If you look down in the right there, you can see polls are open. And you just open that up and you give us your answers. A couple more seconds here. All right, really interesting breakdown. So 76% of you all say that you are self-funded currently, and 24% say no. And what's interesting is when I first emailed the confirmation, and then again this morning, I got quite a few questions about what size should the employer be, and can we go self-funded at this size or at this size? So pretty exciting, and we'll be able to answer a lot of those questions during this. Right now, I have the pleasure of introducing our keynote speaker, Tom Vertich. He is Benefits Strategy Manager, actually Global Benefits Manager now for American Airlines. He's currently responsible for global benefits in 40 different countries. He manages global consulting and broker activities, coordinates and collaborates on local HR business units, and ensures current offerings meet the needs of the employees and those of specific business units. He's got a US benefits background in Fortune 500 corporate human resource benefits for the last many, many years, and we're just very, very lucky to have Tom today. We're going to do a little brief interview with Tom just to kind of understand the state of the industry as it relates to self-funding. So welcome, Tom. I'm glad you could join us.
Thank you.
So the first interview question I have is, what is the difference between self-funded and fully insured?
Well, with self-insurance, you, the employer, are paying the medical bills that are received by your health plan. You still probably have insurance to cover the large claims through stop loss, but basically your company is making a payment for each medical bill that comes in. With fully insurance, all that responsibility is on the insurance company. They pay all your claims, and basically this arrangement allows you to have predictable costs for a 12-month window of time.
And what are the biggest advantages that you've seen with self-funded health plans?
There's a few. The first thing is when you switch to this model, your company is likely to enjoy a decent improvement in cash flow, probably 20% of your health plan costs. And that's because there's a delay on claims getting submitted and processed. Next, you're going to eliminate most of the insurance company's risk charges, and you could be getting rid of state health care mandated coverages that can also lower your cost. And so in most parts of the country, for smaller employers under 100, those risk charges have significantly increased since 2014 when the ACA was fully implemented.
Thank you. And what are some of the challenges that you see with self-funded health plans?
Well, they require a lot more of your attention than a fully insured plan. You've got to monitor and evaluate your medical plan administrator, probably a pharmacy benefits manager, and your stop loss insurance. And you also need to understand how your plan is performing via expanded reporting to ensure you're budgeting properly. But that expanded reporting also gives you an opportunity to better evaluate your plan performance and manage your cost.
Right. And so through that reporting, you can also kind of get a benchmark of the health of your employees and in turn utilize those reports to, determine kind of what kind of innovations you'll be adding to help improve those elements, correct?
Yeah, and you can also compare how you're doing against other employers as well, and that's also helpful to know.
So does self-funding your health plan actually save money?
Generally, yes, it does. Over the long run, it always will save you money unless you're a small employer that routinely deals with a significant amount of health issues in your population.
So for small employers, the biggest thing they might need to look at is one, the health of their population, and then two, kind of where their funds are in order to self-fund the product, obviously.
Yeah, and I think they also need to understand the stability. If their population remains pretty stable, that's usually a good sign to be able to do the self-funding. And they just need to understand the tolerance for the variability in the month-to-month costs of healthcare.
And that comes with a good team like IOA that can actually help them understand it and lead them into the direction they need to go, or others.
Sure.
What innovative ways have you seen employers who are self-funded find more cost-saving options?
Well, for larger employers, carving out the pharmacy coverage from the big box insurance company or the TPA is a huge one. If you're considering this, though, make sure that your consultant has the background to evaluate and help you contract this. Otherwise, I'd suggest hiring a pharmacy consulting specialist or look for another consultant who can do this. I would say the next thing is work with your consultant and insurance company to develop the metrics you need to understand what's driving your plan costs and focus on those actionable cost drivers. And that might mean adding clinical programs down the road once you understand what those are to help your patients with things like diabetes or heart conditions It might mean adding limits or putting rewards to steer patients to the right place to get care. And I would say if you're a larger employer, consider targeted audits as opposed to the random audits. These are going to help you get more money back where you've overpaid, and it's probably going to help you see where you might have possible fraud, waste, and abuse happening in your plan, and give you the chance to fix those problems. And I would say have a conversation about fraud, waste, and abuse with your insurance company. Understand how they control it, and you might not like what you hear. If you're self-funded, try to understand what's different between how they're looking at your fraud, waste, and abuse and how they're doing it with their fully insured business. In that vein, you can also look at things like prepay audits that allow you to better control that fraud, waste, and abuse. You can talk to your consultant who has a good background in targeted audits, and they can help you look at ways to actually protect your plan before you even pay the claim with a prepay audit.
And when you, as an executive at American Airlines with an extensive background in global benefits and self-funding, what advice would you give an employer with 5,000 plus lives when considering taking their fully funded plan to a self-funded model?
Well, it's probably a good idea for most employers. For small employers under 100, especially under 50, make sure your TPA has been around for a while and understand the reputation. It's very, very important. Arrangements for smaller employers typically bundle the stop loss insurance with the claims administration. So you want to find out what their underwriting is like during the renewal times, what it's been like over the last few years. And you might find that the administrator you're considering might be a little too risk adverse, which means they could raise rates significantly to get rid of clients that they don't want to keep, or they might put too many restrictions on individual members' claims. Make sure your consultant or agent has looked at the stability of that administrator with their stop loss arrangement. If they're flipping around a lot, that's probably something I would probably shy away from, just because there's risk involved. And one last thing, if you're a small employer, ask your claims administrator if they can accommodate you by paying the high-cost claims up front and wait for the stop-loss insurance to pay. That usually can help protect you from that unpredictability.
That's great advice as well. And then, what advice do you give the larger employers as it relates to, making shifts within their programs? What would you talk with them about?
I would say, other than predictability of cost, meaning guaranteed rates on fully insured premiums, there's really no benefit to fully insuring if you're a large employer. Your plan is fully credible, which means that next year's rates are going to be mostly based on how well your claims are running. So you're going to be paying the same cost, just perhaps in a delayed situation, if your costs are going up and up and up. And I would say look at carving out your pharmacy and follow my suggestions that I gave earlier and ensure that you have really good reporting.
And how often would you expect to see reports like the ones you're suggesting for either size of employer?
Those are the questions you need to ask when you're in that bid process. I think those are really important questions. I think you ask for samples of the reporting, what their ability is to provide that reporting. Your consultant can really help you there. They should have experience with the reporting. If your consultant doesn't, then I would say you may want to look around, because really you do want to know as much as you can about your plan.
Right. And what about reporting that's sort of triggered by maybe benchmarks and things like that? Do you recommend looking into that type of thing?
Yeah, it's good to know how you're comparing against your own industry. And there's oftentimes you can get comparison industry benchmarking either through the big consultants and oftentimes even through the big box carriers. They can get you some sense of benchmarking to see how you're doing, because you may be having increases you're not happy with, but if you find that everybody else is doing much bigger rate increases, then you may want to focus your attention on other things, knowing that you're performing really well. You probably can't get out of that situation as easily as far as lowering your costs in general. So I would focus on the things that you can control with your own plan then.
Got it. Just one more question. What innovation are you considering to be a good thing to consider in the next, say, 5 to 10 years for self-funded health plans?
Well, I've given a few already. I would say if you're large enough and concentrated in certain areas, geographical areas, direct contracting with a healthcare system is showing promise. As far as looking for wellness vendors with a proven track record of regular ongoing engagement of members to improve their health, that's really, really important. I think we still have a long way to go here, but I'm confident over the next 5 to 10 years, these services will be much more commonplace and more reliable. I'd say finally, we're going to get a lot more data, and we need to. And once we do, and we get more and better data to work with to understand what's happening to our plans, I think we'll also do a better job managing that cost.
Interesting. And the news has had quite a bit of coverage, especially as it relates to genetic testing. I mean, Matt came out and talked about his personal experience with his wife's breast cancer, and thank God she's cancer-free. But the news had a report that said that the AMA is recommending now that women that have either had cancer or are propensed to cancer should be getting these genetic tests to help mitigate, late detection. What are your thoughts with, the American Medical Association saying let's make this a requirement for women that have had cancer or that have people in their family that close enough that have had cancer?
Yeah, I think you have to have a conversation with the vendors and the consultants knowledgeable enough in this area to see whether it's actually improving cost. It potentially can in certain key areas, and you may just want to target it. I think general use of it is going to require a lot of genetic counseling. Without that, I don't see that this is a huge opportunity. Otherwise, I think you're just going to wind up spending a lot of money and not getting cost savings. It may feel good, but without the genetic counselors, I think your program will not yield the optimal result.
So you'd have to have a vendor that could provide not just the test and the results, but then the counseling that goes along with it. Either
Absolutely.
way, whether you have it or you don't.
Yes.
The gene.
Mm-hmm.
You also mentioned direct contracting as an innovation. Can you share some, kind of insight on that and what that looks like and bundled pricing and what that kind of, as innovation, what that looks like?
Yeah, I mean, there's different types. I think one of the things you have to realize is with direct contracting, not every hospital is great at everything, and so I think you want to be careful that you're not locked into something that's really great with heart but really stinks with cancer. If you want to make sure that they can do really well in each category. I'd be careful with bundling in general, because sometimes what you're doing is you're paying for things that you don't want to get good discounts and other things. So really understand what you're getting there in terms of bundling. I think the great opportunity here is you get rid of the middleman in that process, and as hospitals and healthcare systems feel more comfortable taking on that risk, I think that there's going to be a good opportunity for employers to do this. I think also in the future, for smaller employers, you'll probably see coalitions and things like that to allow smaller employers to combine into larger entities.
Oh, that's great. That's a great point. I'm glad that you mentioned that. Regarding, just going back to direct contracting, when you mentioned make sure it's good at, they may not be good at everything. Do you see employers considering going to one hospital for cancer, one hospital only for, heart? Do you see them direct contracting with multiple hospitals based on the outcomes, or is it generally better to try to get one well-rounded approach to the same hospital group?
I think a centers of excellence approach on the really big ticket items is a good idea. You're going to save money on that, and you're going to deliver better healthcare outcomes for the patients. So it's a win-win situation in that situation. For your more general things, you probably aren't going to find as much opportunity to specialize on the hospitals. Plus, it's going to be confusing to members. I go to here for my left elbow and over here for my right knee. That just isn't going to work very well.
Right, and we have challenges anyway with, with figuring out our own health plans just as employees. And so you're right, when you have so many choices, you can end up really struggling with what to do, essentially. So that's great advice as well. I'll just touch on the wellness vendors. You mentioned, the innovation there. What are you looking for in, a future wellness vendor that is innovative from an engagement perspective? Is it digital platforms? What is it that you're looking for to make that work for a larger, mid-size, even a small employer?
Yeah, I think the secret sauce, before I get there, I think the secret sauce is finding a way to drive people to that site. Because you can have the greatest solutions in the world, but if nobody goes to the site on a regular basis, then you're going to have very limited success. So I think that's something that I think all these vendors are still struggling to do. Some are doing a fair job of it as of late, but that's going to be really important. I think the key is any program that's doing wellness needs to find a way to make sure that improved engagement in the patient's health will be sustainable, and so it's an ongoing engagement and not something where they're engaged for a 8-week program and then they fall off the wagon. You want to make sure that they keep that engagement after they've finished the program.
I was talking with one of a large employer who has real success in the area of engagement. And I asked, how did you do it? And, there was a combination of things that they did. They felt really strong about their platform, and it was engaging, lots of gamification, not so much that, people that aren't into gamification couldn't participate. But what she indicated was it was the champion program that they established that really helped the culture of all the executive team being on board and supportive and participating, from the CEO down, and then the champions. So they found the most passionate people in every level of work, whether it have been, the person that's answering the phone to the attorney. And she found her most passionate people. And so she said it was a coupled approach where they looked at kind of what their health plans needed help with. They said, okay, we're having some struggles, say, in obesity and, in stress management. It looks like we've got a lot of, kind of stress related medications and things like that happening. And then they rolled out a lot of education on it, but they really engaged their higher ups to participate in everything, make it exciting. And then their champions get a lot of incentives to be champions as well. And so I think that is, kind of a way to do it. It is a difficult task, but, I know that if you're not constantly looking at it, you'll see people fall off the wagon, as you said. So,
I agree, and I think with those types of any type of program like that, as you're building them, you need to have metrics as an intentional thought in that process. When you're starting it, what do you need to measure to know that you're getting success, and keep on it. You can't know how your plan is doing unless you have the proper measures in place.
well, it's been a great time having this interview with you, getting the insight that you've shared, and we really appreciate you taking time out of your busy day. We know employers, especially right now as you're gearing up for open enrollment, have a lot on your plate. So Thank you very much for taking the time. And I know you're moving offices as well. So again, we appreciate you, Tom. And I'm going to invite Matt to come back up, and we're going to continue on our journey here. And so, Tom, if you wouldn't mind just muting your sound, I'm going to ask for Matt to come back. Hello, Matt. He's back.
Hello.
And then I am also going to ask for Zach and Renzo to unmute your sound and unhide your cameras. Matt,
your position A. You do those like football. Again, a lot of scores, 6, 7,
I think somebody else has unmuted their sound. I'm hearing some background noise.
Aren't you guys have that WhatsApp and log on to the partner about that? Oh, great.
Sorry about that. Bear with us as we switch. So could everybody please check and unmute your sound, or maybe mute your sound? So I'm hearing background noise. Okay, I don't hear it anymore. Awesome. All right, Matt. I also think we have one more quick polling question before I let you take it over here. Let me just ask this quick question. It'll only take us 20 seconds, and then we'll introduce everyone. How many employees do you have? This is for all of you on the line. Under 300, 300 to 500, 501 to 1,000, 1,001 to 5,000, or 5,000 plus. So a couple more seconds here. So interesting, we've got 24% of you that are approximately under 300, another 24 equally 300 to 500, 10% that 5 to 1,000, 29%, the biggest percentage is between 1,000 and 5,000, and then 14% of you on the call are 5,000 plus. So as we address you with this next set of questions, we'll be considering that, and we'll be talking about the various sizes. I'm going to mute myself and hand it over to you, Matt.
Thank you so much, Jenny. Tom, thank you so much for being on here. You set the table for a lot of the folks that we do have on here, and we're super excited to do the interview and have them on here, but we greatly appreciate you spending the time in your busy schedule and kicking this off for us. We're very, very fortunate today to have Renzo Lazzotti, President of USRX Care, and also Zachary Jones, who's a Senior Sales Executive with Script Sourcing. So Renzo, if you don't mind talking a little bit about your organization first, and then we'll ask a question, and then we're going to let Zach go ahead, and I'm going to let him talk about script sourcing as well. And then we'll have a few questions for you guys, and we'll start there.
Great. Thanks, Matt. If Tom is still on, I just want to let him know that I'm climbing the ranks in terms of miles on American Airlines. I live outside of Washington, D.C., and between Reagan and Dulles. American always has the best options in terms of the flight times, as well as the best prices, and I like the Admirals Club also. So if he's on, thank you very much. If you want to send some additional miles my way, I'd be happy to accept them. So a little bit about USRX Care. Folks on the line may say, who is USRX Care? I never heard of them. We're actually fairly well known in the health plan space. We do offer clinical pharmacy and PBM services in the pharmacy benefit management space. However, we're a product of the health plan industry. Directors of pharmacy, managers of pharmacy, consultants to pharmacy departments within health plans, and also over the years providing assistance to health plans in terms of managing specialty pharmaceuticals. If you think of a health plan, it's very similar to a self-funded employer, whereby they are collecting premiums, right? Employer, in a health plan, you're collecting premiums and you're paying the bills, and those bills are your bills. They're not somebody else's bills. It's very different from the traditional PBM industry, where the PBM is administering somebody else's risk, but the risk sits with the employer, right? So we grew up in a true pharmacy risk management environment, just like you have in a health plan, just like you have with an employer. And so what we realized in 2007, after 20 years in the business, was that that type of true risk management that exists in a health plan that is at risk did not exist in the self-funded employer space. So we began offering that health plan style management focused on the pharmacy side to self-funded employers since 2007.
Perfect.
I'll turn it back over to you, Matt.
Perfect. Zach, why don't we go ahead and talk a little bit about script sourcing, then I'll circle back with Renzo. Is that okay?
Yeah, it sounds great. I appreciate everyone having us on. We always enjoy getting to work side by side with good brokers like IOA. And so script sourcing, what we do is we really sit alongside health plans, and we focus on prescription drug risk management. So one of the major parts or major issues of a self-funded health plan really is the supply chain. And when you look at the supply chain, RX or prescription drugs is really the fastest growing segment. I think by 2020, specialty drugs is going to make up about 50% of your pharmacy spend. And so employers are really looking for solutions to be able to mitigate that risk. And so what we do is we offer voluntary $0 copay programs in which we are able to save the employer roughly around 70% off the cost of the medication, whereas they would otherwise get it through their health plan for much more. And so it's really a win-win-win situation, a win for the consultants because they brought so much savings to the health plan, a win for the employer because they save so much money on the prescription drug, and then a win for the employee because all of our solutions are $0 copay. And so I don't need to go through the statistics, but lots of the middle class live paycheck to paycheck, and when you offer them the opportunity to save money on their health care, they're pretty excited about partnering with the solutions that we're able to bring to the table. We bring lots of solutions to the table through a number of different avenues, international network of pharmacies that we use to get a lot of these medications. We work with manufacturers assistance programs. We also facilitate a pharmacy tourism program. And so looking and working with each employer on a case-by-case basis, we're able to bring these solutions to members of their health plans, and in turn, everybody wins.
Fantastic. All right, I'm going to start. I have a quick question because I know it's very unique. Renzo, what is a fiduciary PBM? Can you describe that a little bit for the folks on the call?
Sure, and I'll start off with just a little bit of a story, and I'm going to draw from one of Zach's colleagues at Script Sourcing that has mentioned this in the past, and so I'll steal from his story. But put it into context. If I'm an employer and I'm sitting down with a new vendor, new consultant, someone that's offering some service in the pharmacy benefit space, and that individual, the vendor, introduces themselves and said, hey, I'm so glad to meet you. We got a lot of great programs and services. We can do a lot of great things. I just want to let you know up front that we're not going to look out for your best interests, but let me show you everything that we got. How long is that meeting going to last, right? You're not going to meet with that person for very long. But this is exactly what goes on every day, every week, every year in the PBM space. PBM contracts, and everybody on this call, I encourage you to look at your PBM contract. They all have a paragraph in there that says that the PBM is not a fiduciary and they're not obligated to act in a fiduciary manner, which in so many words means that they could do anything that they want, look out for their best interests first and you as the client second. And it's right in the contract, and those contracts get signed every day, all week, all year, and they have for years and years and years. From a transparency standpoint, and you mentioned transparency being important, I guess you could say that there's transparency there in that it's right in the contract and everybody signed up for it when they're hiring that PBM. A fiduciary PBM takes the opposite approach. In our case, we put fiduciary language in our contract. Fiduciary is a term that is defined by ERISA, and that language that defines a fiduciary is in our contract, and we apply that to us. What does that mean? That means that there's no conflicts of interest. That means that all utilization and financial information is in full view. It's fully disclosed. There's no hidden revenue. There's no hidden rebates. There's no hidden pricing. Everything is in full view and accessible both to the consultant and the client. And most importantly, we're obligated to look out solely for the best interest of the client and their members.
This couldn't be more true. We have the opportunity sometimes to work with folks, and they don't even realize what's in their contract because it's so watered down, and the consultant or the broker doesn't really understand and know the contract language. And that's why it's so important with folks like you, and then also to have Kevin come on here in a minute. But the fact that you both work together, it's amazing. And you guys have so many programs. I know we don't have all the time to list all the programs that you work with to help save employees and the employers money, especially if you have like a, hemophiliac or something that could just really hurt a plan. I mean, we've all been down that, we have those, and we just have to figure out how to manage and work through those strategies. But you guys are so fantastic at working together, creating strategies that allow the employer to make educated decisions, and you are always on the forefront and being upfront with the cost and totally transparent. And that's why you guys are so fantastic, not to mention the fiduciary responsibility. Zach, you mind if I ask you a few questions?
Yeah, shoot.
What are some of the outcomes of having alternate solutions for brand name specialty medications?
Well, I mean, if you think about it, we'll talk about outcomes, but I want to kind of preface it by saying, if you think about a business and somebody who has P&L responsibility for an employer, one of the things that is very important to them is that they want to have options, right? And if they're paying too much money for a specific line item on their P&L, they want to, if they feel like they're getting gouged or not a good deal, they're going to go back to the market and they're going to go to their competitor or try to renegotiate. And if you think about a self-funded health plan today, that currently doesn't exist. They have one way to get a medication, and whatever the health plan says it costs is what they end up paying. And so when you present the opportunity to them to say, look, we're giving you the opportunity now to get the same box of apples for less money, are you interested in those programs? It's a rhetorical question. Everyone's going to say yes. And so the outcomes is you start to be able to present these options and put money back into the bottom line. And when you start putting money back into the bottom line of a business, it provides them the flexibility to offer better benefits. And in the state of the union we're at now, with unemployment at all-time lows, it's never been more pressing to be able to offer programs to entice, recruitment and offer better things, to those that you want to be a part of your organization.
Understood greatly. How do you think employees respond to the ability to reduce their out-of-pocket costs through the other RX solutions, making suggestions or trying to have them educated? How do you think that they feel about that?
Well, I mean, I can just tell you from example. I mean, they're ecstatic when you're able to go to some of these employees that make a middle class wage, and you say, look, our program is the difference between a good Christmas and a great Christmas. These employees, for some of these medications that they're on them for the foreseeable future. They're paying $100, $200, $300, maybe even more dollars a month in copays. And when we're able to offer them a $0 copay solution, a lot of times they're in tears and they're ecstatic, and they really appreciate that their employer is able to offer a program like this to them.
What do you think about the employers who are on the fence or unsure about trying out of the box? I know you guys have some situations that you go out of the country to bring in medications. What do you think about if they're kind of on the fence and they waver a little bit? How do you help educate and promote that?
Well, I mean, that's a great question. I mean, that's really the only hurdle. One of the things that Renzo mentioned is kind of how he sits on the same side of the table as the employer. And that's really one of the big problems in the industry is there's a lot of the misaligned incentives that exist. And so when I'm sitting down with an employer, we make them realize, look, we're a performance-based solution. We don't get compensated unless we actually save your health plan money. So there's no financial risk to you. And because the program's voluntary, you really put it all the way down to the employee level, whether or not they want to participate. And that to me, I think, is really critical in terms of being able to evaluate whether or not this is a program that you would want to implement. But when we explain that to an employer and saying, look, the liability is not on you, it's a voluntary program, and the employee gets to decide if they think it's in their best interest and their family's best interest.
So to reiterate that again. So how do you guys get compensated? I just want to make that clear.
Yeah, so if you sign up today, Matt, you have an employer group, they sign up with us today, and for whatever reason, their employees are really healthy or not interested in using our solution, we don't get $1. There's no admin fee, there's no PEPM, there's no technology fee. The only time we get compensated is in the essence that somebody uses our solution to source a medication, and we get paid a percentage of the savings, and then the employer enjoys the substantial amount of savings they get too. And if they don't utilize it, then no harm, no foul.
Perfect. One more question. What type of employee communications have you that help the members fully understand the benefits? Like how easy is it? Is it difficult? What measures are you using? Just because we know how difficult it is for employees to become engaged, but what have you done that's been successful?
Yeah, so I think the big thing is the most important part of what we do at script sourcing is our client engagement. We're very proactive with the groups that we work with and identifying medications that we can help with, working with teams like yourself, the HR and benefits folks at these employers, where we're creating posters, we're putting videos on employee intranets. We have account executives that will go to open enrollment meetings. We do outbound phone calls, texting programs, really whatever is going to work best with the employer, because the ultimate goal is to have the employees understand, listen, if you're on a medication that costs a lot, a type 4 medication, we have this program where they may be able to assist you in getting it for no cost to you. If you want to continue to do what you're currently doing, you're more than welcome to, but we find that our employees that engage this program like it and end up saving a lot of money.
Perfect. Perfect, Zach, we appreciate it so much. That's all the questions I have. Is there anything else you want to add that's final?
No, I just really appreciate having us on, and then just the reality is that I think every self-funded health plan needs to sit down and look, do we have more than one way to access these medications? And for a lot of the self-funded health plans out there, the answer is no. And so you need to start asking yourself, can we get more options? And do we have advocates that are sitting on the same side of the table as we are, like Renzo and like our program?
We appreciate you greatly. Zach, if you don't mind, I'm going to hide your camera. We're going to invite Kevin with Remedy One to join us. And Renzo, please stay on. We'd like to have you on.
Sure.
Kevin. Well, Kevin, hello. Kevin is the CPA and the president of Remedy One. And Renzo and Kevin and Zach, they all intertwine with one another. And Kevin, if you don't mind, would you mind telling us a little bit about Remedy One before we ask a few questions and go through a couple slides?
All right, I was on mute. Remedy One is a company, is based in the US, is a RX consulting firm that assists employers in making the decision and navigating this environment. I kind of equate this environment to buying a used car before the internet. You really never knew what you were getting, and you have a bunch of entities that have very complex processes and contract language, and it's often very difficult to get a true independent view of how they stack up against each other. So that is our job, to bring that type of expertise to our clients, and we're truly an advocate for them in navigating this space. And then we also work with Renzo. We have a great relationship with Renzo and USRX Care. We've worked with them in many aspects. He not only has a great PBM solution, he has some great what I would consider clinical programs that are top in the business, and we often recommend those to our clients.
Fantastic. Do you want to go through a couple of the slides that we have for you?
Sure. So the main question here is why hire an RX consultant, right? So the reason for that is it's a complex process. I'm getting a little feedback there. So it's a very complex process that employers are trying to navigate. We have contract expertise looking at a lot of times what happens in this business is when you are working with a PBM, it's all about the contract language in the contract. You can get a rate sheet that has very specific cost points on them, but until you see the contract, which are often 30 pages long and very hard to interpret, you need somebody that knows these contracts. I used to work on the PBM and health plan side, so I would write those contracts. And the sole purpose for a lot of those contracts is to be able to extract value for that PBM. Now, there are some great firms like Renzo's these days that are doing it transparent, but there's a lot of firms out there that aren't as transparent. So it's our job to help our clients make the right choice based on the overall financial value of that deal. We offer reporting. We have on-staff clinicians that, anytime an employer is looking to move potentially to another PBM, disruption is always a big deal. So we have a team of clinicians that help our employers look into what does it really mean if you have to switch an individual from one medication to another. We bring a lot of cost savings programs to our clients, right? So Renzo, we work with him and he has a great program around physician detailing that we promote to our clients all the time, because I think part of the difficulty that you have is if you're with a large PBM, their formularies are constructed in a way that drive brand utilization, to drive rebates. So you really need a solution that tries to minimize that brand utilization, and Renzo's got a great program that does that. So we actually are selling that oftentimes to our clients. So and we really have proven that we drive cost savings, because at the end of the day, everything doesn't matter unless we're saving our clients money. And on average, when we go through our PBM procurement process, we save about 20%, and I'll talk a little more about that, and then offer trend management support. And the other thing that I would mention here is we're independent. We are an advocate for our client. I don't get paid any more or any less, depending on where that ultimately lands from a PBM perspective. So my client is who I'm aligned with, and you don't often see that when you have different coalitions approaching employers and wanting them to join the coalition, because we believe that you should look at multiple options. Not that coalitions are a bad thing, but you should be looking at them in the context of other partners to see if they're the best fit for you.
Speaking of let me ask a real quick question before you go on. A lot of consultants have their own consortium or coalition or things like that out in the marketplace. Now I know you come across those. Are you able to give big details on the difference between other folks and how you're doing that? Can you talk about how you guys compare and what you do through that process real quick?
Yeah, so coalitions, the whole idea behind them is they try to aggregate lives to get the best pricing, which may or may not be in the best interest of our clients, right? So depending on client size and what they're looking for, we may include coalitions in our RFP process, but we're not incentivized to put it into a coalition. And what we try to do is work directly with the PBMs to determine, based on not only financial factors, but service and clinical factors, to see who's the best fit. Because if you look about what employers are looking for now, this idea of chasing rebates and finding the PBM that's generating the most rebates is starting to fall out of favor. People are looking for a PBM that is going to provide them solid economics, but also help them manage their group from a clinical perspective. Make sure that they're adherent, make sure that they're on a lowest net cost formulary that isn't just driving rebate yields because that's what sells in the marketplace. So as the market evolves, I think you're going to see more and more interest with PBMs that really have invested heavily in their clinical programs, because that, to me, is the next generation of savings. And you can see what's on the screen right now. It's talking about our procurement process. We call it Procurement 360, and it looks at all those factors. And the image on the right is kind of a financial analysis that we provide an independent, objective view of all the financials of the different PBMs. And we try to take into account things like clinical savings guarantees. So if a PBM is going to put money on the table and guarantee savings, it should be accommodated in the financial analysis that's done for that employer.
Perfect. That's a great answer. Thank you. That's exactly what I was looking for.
So this slide is after we get past the procurement, right? So if you look at kind of the steps involved, you want to do a procurement process, right? Make sure you're partnered with the right PBM. And then you want to start looking at clinical programs, right? So with our team of clinicians, we're able to evaluate a PBM and determine, does that program make sense? So there's a lot of talk recently about diabetics and a lot of programs around getting meters in the hands of people and making them sure they're connected to the internet and getting their scores in. So technology is a big thing, right? We also look at trend management programs. The US RX Care program is one, script sourcing is another, right? Zach was just on talking about his program. Our job is to fully vet these programs and bring them to our clients as solutions. Since we're a trusted advocate, bringing those solutions ultimately helps our clients save money, and that's what we're really interested in. Another example of that is we have a specialty copay program that we sell that allows employers to get access to manufacturer dollars and save between $5 to $7 PMPM savings on their specialty spend. And we all know specialty spend is a big issue for a lot of employers out there. And then the other thing that we look at is we have a full suite of audit services. So not only do you want to make sure that when you negotiate a contract, you want to make sure at the end of the year that you're actually receiving that value from your PBM, because there's a lot of games played and slight tweaks in language will have a big effect ultimately on the value you get. So anytime that you sign up with any PBM, having an audit in place at the end of the year to ensure contract compliance is important. And then the third thing here is we look at channel management, right? So there are situations, and kind of the new and the bigger companies are looking at, does it make sense for this to go through the medical benefit or the pharmacy benefit? So there's a lot of savings that can be had by looking at channel management and going down that path to see what's in the best interest of the client, because oftentimes things are recommended to our clients based on how it benefits the individual that's recommending those things. So we're here to kind of sort through all that and say, yes, it is valuable or it's not, or don't forget about disruption, or don't forget about this, because that's our job. We're independent and objective.
Perfect. Perfect. Renzo, do you mind if I ask you a question?
Yes, please.
Many would say the largest three PBMs have dominated the industry for years and continue to do so for a reason. In other words, bigger is better. To the customer when it comes to PBMs. What would you say to that?
Well, actually, if we can go, I had a couple of slides. Maybe we can go back to the first one. Keep going. Let me go back to the previous. Keep going. This one. All right. So this is the best, I guess, I could answer this question, and we'll talk about it in a number of different ways. So these two slides are typical examples of what employers have enjoyed in terms of change of their prescription drug spend on the basis of our activity. I think you'll be hard-pressed to find a PBM out there that can say that in the first year they cut a client's cost by 34% or 40% or 50%. We've got hundreds of clients that have that same experience every year. Most of our clients have that same experience every year, unless they don't have much utilization. This comes from managing the benefit like it's your own risk, which is what we did in health plans for years and years and years, right? So we're offering that same service to employers. There is so much waste in the system. When I talk to clients about the traditional PBM model, it offers a lot of benefits, but at the end of the day, PBMs are in the business of selling drugs to beneficiaries at a profit, right? If you don't understand anything about the PBM industry, if you understand that, then you understand the PBM industry. PBMs are selling drugs to members at a profit. They create a spread on the drugs. In other words, they pay the pharmacy one price and charge their client another. They have revenues coming from manufacturers that incentivize them to alter their formularies or to adjust the way they do prior authorizations. They get discounts in their mail order and specialty pharmacy that the employer doesn't see or know anything about, that could be upwards of 30+%. So there's a lot of money in the works in the traditional PBM. Every drug that goes through their system they're making a commission on, if you want to think about it that way. To put it another way, that speaks to the conflict of interest that exists as a result is the more an employer spends on their pharmacy benefit, the more the traditional PBM makes, right? I'll say that again. The more the client is spending on prescription drugs and their pharmacy benefit, the more the PBM makes. You don't have to be a rocket scientist to know there's a problem there, right? It's an inherent conflict of interest. When you take those conflicts of interest out, for example, we don't own a pharmacy, we don't own the mail order, we don't own the specialty, we charge a flat fee. Our sole goal in life is to manage that benefit like it's our own. We make the same amount on a $100,000 drug as we do on a $2 drug, right? That's not where our incentive lies. Our incentive lies in driving the highest ROI for the client by delivering the best care at the lowest possible cost. And that includes optimizing the prescribing, both non-specialty and specialty, making sure that if it's a high-cost drug, that it's appropriate. We dig into the clinical record. There's a lot that's going on in the industry. PBMs that are proud of the fact that they can do a prior authorization in 2 seconds electronically. If you're doing a prior authorization in 2 seconds electronically, you're not looking at the medical record. You don't know what's going on with that patient, and you're putting a lot of stock in that one piece of paper that comes in on the fax machine. That's not the way health plans manage their risk, and that's not the way that employers should have their risk managed. So these types of results is what you get when you strip away those conflicts of interest and focus on cost, quality, and care management. You can go to the next slide quickly. Again, to reiterate, in the traditional model, there's a lot of perverse incentive. I'll call them perverse incentives. Drugs that are placed in the formulary because of manufacturer collaborations between the PBM, with the manufacturer. All of that, again, in the fiduciary world, you want to collect all of the manufacturer monies that you can, but you don't want to structure your entire benefit around that, because at the end of the day, it's going to end up costing you more. We'll skip quickly to the next slide, and I'll just kind of wrap up this thought process. We believe that every employer is entitled to 3 things in their PBM relationship. If you've got 2 out of 3, you got a problem. You need to have all 3 of these in order to be successful in both delivering care, but also managing your costs. The first everybody talks about, which is transparency. It's way overused. Back in the day, Medco used to say they were the most transparent PBM in the industry, but if a client asked for a detailed claims file, they were told it was proprietary, right? Good luck getting detailed claims record out of a lot of health plans still today, right? They keep that close to the vest because I think they don't want folks to know where all the money is, right? So to us, transparency means everything is in full view. All of the claims data is in full view. If you ever want to check on a price at a pharmacy, ask for the invoice from CVS for that drug on that day, and it should be exactly the same as what you're being charged. There should be no spread. So full transparency completely. The second thing is the fiduciary. If a PBM is not signed up to act in a fiduciary manner, then all of those issues that exist in the PBM space that are coming out in the news more and more and more are going to exist. There's profit incentives in mail order. There's profit incentives in specialty. That impacts the clinical reviews. It all ties in together. At the end of the day, if your PBM is making money off of selling drugs to your members, you have a problem. In a fiduciary world, you can't do that, right? It's the same as having a financial advisor that's a fiduciary and one that isn't. You want to be working with the one that is. It doesn't mean that PBM can take over the fiduciary role. That is the role of the self-funded employer, but they can certainly hire a PBM that is fiduciary compliant, right, is living up to fiduciary standards. And if they figure that there's a conflict of interest, you could not only fire that PBM, but take them to court, right? That's important, that you have somebody, as Zach said, that's on your side of the table. You're not always wondering if the PBM is doing something in their best interest, but not in your best interest. And then the last part is who has the most experience managing pharmacy risk. First of all, if you can get past those first 2 hurdles, you've got a very, very small number of firms out there that meet those two criteria. But the last part is the risk management experience. We've been managing pharmacy risks and health plans since the mid-90s. We're good at it. We have a lot of programs in place that you will never see in a PBM because it would be contrary to their model. It would cost them money at the end of the day. And we leverage every opportunity that we have to get the medication to the member at the lowest cost and also the lowest cost of the plan. Back on that first slide, the group on the left, which happens to be an IOA client, I will say, is also a script sourcing client. We've saved that organization millions of dollars by not only managing the utilization, but also sourcing at the lowest possible cost. We've got a number of high-cost drugs for that organization for free, and we do that all day long. That's not something that you would see in a typical PBM environment. So with that, I'll turn it back to you.
Thank you so much. So you guys do an amazing job. I mean, there's absolutely no doubt about it. And what you're doing is earth-shattering, and it's almost hard for people to believe when it's staggering numbers and the savings that you can predict and knowing because you have all the data. And I'm just so happy we do business together. I mean, it's just amazing. And just thank you for your time and being on here. Kevin, I got a couple questions for you.
Yeah.
What services do RX consultants provide?
Well, I think the main one is the procurement services, where we work with employers to determine which PBM is the best fit for them, right? So we have a comprehensive financial analysis. We have very specific, what we call minimum bid requirements, because the key is to make sure that every PBM is adhering to the same rules when they're bidding on your business. Because if you don't, and you allow a PBM to dictate what they're going to underwrite, that's when you lose the ability to, compare several options. So that's a big piece of what we do. And then we provide audit services. We have trend management services. We work with a bunch of different vendors to offer solutions to our clients. We troubleshoot. We had a client the other day that had, and Renzo would find this interesting, that had a bunch of non-NDA approved medications going through their benefit. And we all know that that should not be happening. And it was to the tune of about $250,000. So wow. There's a lot of that stuff happening out there, and we are helping our clients navigate that space.
Why do you think it's important to bring a consultant to manage the RFP process?
Well, I think like anything else, you need someone that has the in-depth contract knowledge, knows the games that are played in the industry, since a lot of what we do is so financially driven and the details are in the contract. A lot of times what brokers will do that are unsophisticated is they will just show a spreadsheet and look at the top line number. Mm-hmm. And unfortunately, the downside of that is all the detail is in the contract language, and it really doesn't account for the clinical programs that are available out there. So I think bringing somebody in like us in combination with your broker and, the partnership that the three of us have has really produced some great results because we're cognizant of all the issues and we're accommodating for those things in our process.
I couldn't agree more. And I told Jenny whenever we first started putting this idea together, getting everybody in this process, I said there's gonna be a lot of brokers and consultants in the community that are not gonna be happy with me because we're totally letting everybody see what's going on. They are not gonna be happy because we're totally transparent too. I mean, just as everybody talks about how much financially is involved from your perspective, from their perspective, we do the same thing. In legislation right now, there's a big push for all the brokers that have to divulge how much they're making on all their clients and prospects. We do that anyways. So we're like, oh, this is great because now it's a level playing field for everybody. You have some brokers and consultants out there charging 75 cents a script on groups over 1,000 employees. I mean, they're making a ton of money and the employer doesn't even know. Little things like this. I mean, it's just unbelievable the ways that you can make money. But with all the honesty and integrity you guys have, I just greatly appreciate it. Any last comments real quick before you guys jump off?
Yeah, Matt, if we could just look at the last slide, because this really wraps up and ties into what Kevin was talking about in terms of looking at the whole picture. One more. Okay. Up. Back up. Back one. Okay. So this is just an example of what a quote would look like, from a fiduciary PBM such as ourselves. And also, Matt, you had asked the question, big is always better, right? So this is a comparison against one of the big box entities, right? And just looking at the discounts on the network, they were not the lowest cost. And you would say, how is that possible? Express Scripts, CVS, they have to have the best cost. They do have the best contracts, the best cost, but that doesn't mean that they share all of that with the client, right? They keep some of that. So if they were to pass it all on, they probably would be the best in the band, but it doesn't generally happen, right? So they're not always the cheapest. That's the first thing. And the second thing is, if you look below the top section that looks at the pricing in the various pharmacy channels, even on rebates, they keep rebate dollars to themselves back, on their side of the fence, as opposed to passing it all through. So they're not necessarily going to be the cheapest on the rebates. You look at, we talk about therapeutic optimization. That's the clinical management that Kevin was talking about. If you're not managing clinically, you're leaving a substantial sum of money on the table, right? Copay assistance savings. This is a program that we collaborate with Kevin and his team on. Those are dollars that are available that the manufacturers are putting out there that we want to take full advantage of to help offset costs. All of these things that are below the line are not present in the traditional PBM quote, right? And there's so much money available outside of just what are the network discounts and what are the rebates. And that's the kind of thing that we believe is the future of this industry. And that's, it's focusing on those things that is going to get the 30, 40, 50% cost savings, as opposed to what is traditionally the case, where costs are going up year after year. I'd be curious to get Kevin's thoughts on that also in closing.
Yeah, it's actually interesting because this looks almost exactly how we present it, right? So you have the financial piece up front and all the minimum requirements that go into that, and then now you're looking at clinical programs. And to me, this is a true representation of what you're going to save, because ultimately what we're trying to do is tell a client, okay, if you signed up with this PBM, what are your costs going to look like next year? And this is a very good way of doing it. So yeah, this is great. I love it.
Yeah, so we're showing, a path to 30% savings here conservatively in this particular group. And, that's conservative. And if you add all the things that Zach and his team puts in place, getting over 50% is not that difficult. It just is not that difficult. You just need to be structured appropriately.
Perfect. Gentlemen, thank you so much. Appreciate greatly all your wisdom and knowledge. Thank you for being on. At this time, go ahead. You guys can jump off, and I'm going to introduce Lisa here. But thanks again. Take care.
Thank you.
Thank you.
There we go.
Hi, Lisa. How are you doing?
I'm doing great. How about you, Matt?
Fantastic. So this is Lisa Brower, and I know it has president underneath your title here, but you are also the founder and the owner, one of the owners with Holly, of a great TPA that we love utilizing, Preferred Benefit Administrators. Can you tell us a little bit about Preferred, Lisa?
I sure can. Thanks again for having us, Matt. We really appreciate being part of the summit. I am Lisa Brower, and I'm the president and co-founder of Preferred Benefit Administrators. We are actually a full-service independent TPA located in Central Florida, and have been successfully administering self-funded health plans throughout the United States for almost 22 years now. While the core of our business is self-funded medical plan administration, we also do so many other types of plans. We handle self-funded dental and vision plans, HRA plans, flexible spending account plans, COBRA administration, and since the inception of ACA, we've been an approved IRS reporting vendor. Our goal is to provide as much value as possible for each employer and broker we have the opportunity to meet with and work with. My business partner, Holly Coffey, and I are both very involved in the day-to-day operation of Preferred. We both take a very hands-on approach to running our business. Since we're so involved, we can make immediate decisions and put them into place instead of having to go through layers and layers of management to make a change or implement a new program. This has been a really important reason why so many brokers and clients continue to do business with Preferred. Our focus is and always has been on providing personalized service for all of our groups and our covered members while constantly looking for the most cost-effective solutions to help reduce administrative costs. And our employee culture resonates with the employees' commitment to personalized service and resolving issues. Our employees actually have the knowledge and experience to know exactly what needs to happen to resolve any issue that might arise. They know who to go to for resolutions, whether it's a coworker within the office or one of the key plan partners like the PBM or even a medical provider. We never hesitate to pick up the phone and do what's necessary to help. So that, Matt, pretty much summarizes our history and our business model. Do you have any other questions about our services?
I have a few questions, if you don't mind. Can you explain what a TP is and what your role is working with a self-funded health plan?
I will be happy to. A third-party administrator is what a TPA is. An employer interested in self-funding their health plan will actually need to select a TPA for the day-to-day administration of their plan. The TPA actually takes on a variety of responsibilities, such as claims processing, customer service, adds terms changes in eligibility, generating ID cards, monthly reporting, and actually that's really just the tip of the iceberg. We create plan documents, SPCs, track and file large claims with a stop-loss carrier, and the list just goes on and on. Because we handle so many of the day-to-day logistics of the plan, it's really an important process when an employer is trying to determine and select who their TPA will be. No two TPAs are alike, and any employer going through an in-depth analysis will realize that. We also work closely with all the key plan partners, such as the broker yourself, stop-loss carriers, and the PBM, to put together a seamless plan for the employer and their covered employees. And on a high level, that's pretty much a summary of what we do.
Okay, and very well, I might add. What are the benefits of choosing an independent TPA to administer a self-funded plan instead of a large insurance carrier-owned TPA?
That's actually a really good question, Matt, and one we wish we were asked more. While many employers and brokers think that selecting one of the large insurance carriers to administer their self-funded plan is a good move, it actually does have its share of drawbacks that are actually often overlooked. Establishing a self-funded health plan allows the employer to pick and choose the best partners to integrate into their plan. There are a lot of great partners out there in the self-funded market. When using one of the large carriers to serve as the TPA, their options are very limited and sometimes they have no choice at all. And in some cases, an employer ends up using a PBM or a network or a stop-loss carrier that are all owned by the insurance company. In comparison, when working with an independent TPA, we allow the employer to choose the network that's strongest in their demographic area. This could be a local or a national network, or sometimes both, to ensure adequate access. And we can accommodate those types of arrangements. The employer can also select a PBM they believe offers the best prescription savings and one that will share rebates with them and the plan. And in addition to everything I just mentioned, the employer also has a wide range of stop-loss carrier options to choose with an independent TPA. The biggest drawback we see with a large carrier administration is access to claims data, and that was brought up previously earlier in the summit. While it might not seem like a big deal going into the first plan year, it is a huge deal when access to data is limited during the renewal process. It makes it extremely difficult to negotiate or shop for the best stop loss carrier or make suggested plan changes based on member utilization. The carriers house all that data, and the broker and the employer need to secure a favorable renewal from the plans, but the carriers are usually unwilling to share it. This is very frustrating for all of when all we want to do is present a client with a fair and competitive renewal.
I understand that. And that's so important when we're out there working and everything's so competitive. We want to absolutely get down to the bare bones and go to battle with every carrier we can. And you know that more than any. What do you think makes your TPA better than other TPAs?
It's actually a really good question with a very simple answer. And it really boils down to accessibility. We believe having direct access to the right people to ask a question or share concern gives us the ability to immediately answer the question and figure out a solution. I'd like to give you a couple of examples. At Preferred, each client is assigned a specific claims analyst. Our claims analysts answer phone calls and emails directly from covered members and our group contacts. And the claims analyst is also the actual person processing claims for the group. We've learned there's a high level of member satisfaction gained by being able to interact directly with someone who's familiar with your claims history, instead of being tossed around a customer service department and having to explain things over and over again. We also assign each client an experienced eligibility specialist. Brokers and benefits department love having a dedicated contact they can talk to and get an immediate response from. Sometimes it's a simple request like how to change a last name or how to add a dependent, but other times it can be a really complicated situation where the employer overlooked submitting information on a new employee who has a medical appointment that afternoon. Our eligibility specialists can load the member in our system, and since we have direct real-time access into so many PBM systems, we can load their information in there as well. So that way when they're done with their appointment, they can have their prescription filled without any issues. We can also send a temporary ID card and contact the medical provider to get them the eligibility and benefit information they need before the member's appointment. All of this can happen in a matter of minutes because we really are accessible. The final area when it comes to being accessible is that we make sure data is easily accessible to the broker and the client. When it comes time for renewal, we don't have a problem in sharing this. It helps obtain the best possible renewal for any of our clients. We don't have any conflicts of interest with any of our plan partners because we are independent. And our underwriting team can gather any data needed, so plan expenses can be analyzed, plan changes can be recommended, anything gearing towards helping contain plan costs is our goal.
Awesome. Well, I have a couple more questions. Okay. Tell us about some of the cost containment measures that you have in place to help reduce plan costs.
I will do that. We actually have a lot of them, but I won't go into all those details on this. I'll do it next time. First and most importantly, while we embrace technology wherever we can, we still believe a self-funded plan should always have an experienced claims analyst reviewing and processing every claim, instead of letting a claims system that's fully automated take over this critical portion of a plan. Most people don't realize the majority of medical claims submitted to an insurance carrier or TPA are auto-adjudicated. That means the provider submits an electronic claim. It's then processed by the insurance company's claims software without any human intervention whatsoever. When you have an experienced claims analyst processing claims, the analyst can see the big picture related to a member's course of treatment. Many times a single claim may not reveal, for example, that this is related to an auto injury and that an auto insurance policy should be paying first, or possibly that this claim was a workers' comp related claim. By the examiner reviewing the pre-certification notes and clinical notes on a daily basis and knowing the red flags to look for, we can usually spot claims that could possibly be overlooked if they were going through an automated claim system. We're also extremely efficient. We keep plan costs down by doing as much as we can in-house. This helps save on additional administrative costs for the employer. We see so many times where TPAs nickel and dime their customers for services that are standard in our fees. Things for like ID cards, plan document creation, plan amendments, SBCs, all of those things can add up very quickly and increase an employer's costs. Another area that we take very seriously is our out-of-network claims. We look at every single out-of-network claim, regardless of the dollar amount, and we attempt to negotiate a discount. Many TPAs will set a threshold of $1,000 or $5,000, but we don't. We do our best to get a discount on every claim, even if it's a $20 claim. And on the flip side, we also look at our PPO network claims. We are so prompt and quick in our claims turnaround processing that if we see an opportunity to where we can contact a provider and say, we can get this claim and a check to you within 10 days if you offer an additional 5 or 7% discount. A lot of times a provider will take that because the fully insured carriers and the large insurance carriers that are doing TPA work, their turnaround time is nothing like ours. The last piece that I would like to bring up, which can be significant for an employer in a plan, is that there's serious claim dollars at risk at the end of a stop-loss contract. If a member has high dollar claims throughout the year, we want to make sure that every claim applying to that contract year is paid within the required time. If it's not, the employer is losing out on huge carrier reimbursements. So towards the end of every plan year, we look at our pre-certification records to make sure we've received a claim for every hospital confinement or surgery. And then we take it one step further and we make sure we've also received claims from the other related providers that may have offered treatment, like an ER physician or an anesthesiologist. If the claims haven't been received, we actually reach out to those treating providers and request that they get their claims filed. So with all that being said, we're always open to new innovative and cost-saving solutions. Since we are a hands-on TPA, we evaluate these solutions quickly and can implement them quickly, which makes us such a valuable partner for every broker out there and the employer.
Perfect. How about one final question?
Okay.
What do you think the future holds for self-funded plans in the TPA industry?
We're actually really excited about the future of our industry. So many employers are becoming more and more interested in the concept of self-funding. We're also seeing a much larger volume of quote requests and proposals from the broker community for clients that are fully insured and now are considering self-funding. Also seeing the demand for knowledge and the level of participation for summits like this one just reinforces the growing interest in self-funding, and we're just glad to be a part of it.
Well, perfect. Well, we're glad you're a part of this, and I can speak from experience. We have all different size groups with you. When you say hands-on, you are not kidding. All the way down from a client of mine want a certain logo on a plastic card, not a paper card, a plastic card, all the way to having amendments done with, single case agreement situations and having an amendment done in one day for a special authorization for a child that was in another state. I mean, you guys are fantastic. Mm-hmm. You do such a great job. In closing, would you like to say anything?
No, I just, well, besides appreciating the opportunity to be part of this summit and looking forward to doing new business together with you and all the other partners and continue our education.
Perfect. Well, the education, we're going to definitely set up something with Jenny and her team, and we're looking forward to that. But thank you so much, Lisa, for being on. Greatly appreciate it. I'm going to invite Jay to come on.
Okay, terrific. Thanks.
Thank you, Lisa. Hey, Jay. Jay Hamilton is a sales executive with Stealth, and we use him for the stop loss all the time. And I know that you've got a couple slides we're going to add as we're going through a few questions. So, yeah, Jay, why don't you tell us a little bit about Stealth before we get started, you and yourself and Stealth?
Yeah, sure, Matt. Well, first of all, thanks for having me on. I'm Jay Hamilton, and I've worked in partially self-funded health plans with brokers for, June this year will be 21 years.
Don't ask me how long we've known each other either.
Yes. So I've worked all around, the Southeast with a high concentration in Florida. Did a lot of wonderful work in Florida over a lot of years, and love that marketplace. And today I live up in Charleston, South Carolina with my family, my wife, 2 sons, and our dog. And so we're loving it. And as far as Stealth, Stealth is the nation's largest managing general agent for stop loss, specialized in stop loss, and it's an honor for me to work there. The company itself's been around for a decade, and it's staffed with what we think are all really, really top quality talent in our industry. Stealth, again, it's a full service managing general agent, ultimate interoperability, no matter what, payer, network, PBM, the universe is vast and wide. We've heard from some of the best and strongest today on the webinar, but we work with all of them. So we think that gives us a really good vantage point to do good work in the stop loss space. Yeah.
Yeah, and you guys do fantastic work. You're a huge partner for us. So you ready to get started?
Let's roll, buddy.
All right. So obviously, appreciate greatly you being here. Let's imagine I'm a self-funded employer with 1,500 employees in my plan, and I have a really strong C-suite and consultant partnership, a rock-solid balance sheet, a well-thought-out plan design, and fabulous cost containment strategies in place, and vendors with a great network. Why do I care about stop loss? Why do I care about the stop loss insurance I have?
Yeah, well, I'd like to congratulate you. You seem to have been really, intentional in setting up your plan, and you got a lot of great raw materials in place to pull off something that every large employer in America sort of challenged to do cost efficiently, and that's run the benefits plan. So the answer to your question really does come back to basic risk management strategy. Everything you just said, we can sort of think of as specifically a management strategy, which is super important to understand when you're talking about a 7 or 8 digit, maybe even a 9-digit spend in some cases, depending how big the health plan is. And so this grid is something we really use a lot. I've used a lot to kind of help frame the broader risk management strategy. And it really is a sort of a foundation for how humans have dealt with risk in all kinds of domains over time. But basically, a risk has 2 attributes that we can easily measure and quantify, and that is frequency and severity. So frequency we can think of as how likely an event is, and severity we can think of as how costly or impactful that event is. And in the context of a health plan, we'll talk a little bit later about what those things are. But basic strategy in risk management says if something hurts really bad, it's really costly and it's really common, you just do not do that thing. Conversely, if it doesn't hurt very bad, it doesn't happen very often, you retain that risk. You don't buy insurance for it. You don't stay up at night worrying about it. You just let nature take its course. The other quadrants of the graph are a little more nuanced. And so always keeping in mind incidence and severity when something is frequent but not very severe. The playbook tells us that manage is the proper tactic to use. So that's that bottom right quadrant. So in your health plan, these are things like kind of everybody's talked about on the panel today. That's getting efficient unit costs. That doesn't really mean buying insurance. That means having things like, good, transparency and, good unit cost on prescription drugs, having visibility into the spend, perhaps medical tourism, but just things that we can do to get better unit costs. So our panelists are doing an awesome job talking about that today. What I'm going to talk with you about is risk transfer. Now, this is a different thing altogether. And, in the corporate risk management world, we've got a lot of work to do as an industry, and it's really important work. So my particular quadrant of this is the risk transfer part. And so we can think of risk transfer as the proper tactic to use when the severity is very high and the frequency is too low. So to be sufficiently predictable. And that's sort of, despite our A-team's best management efforts, we can't really manage a population well enough to ensure that, cancer, as you alluded to earlier, or, premature infants that happen in the world, or other type of accidental things that result in burns won't happen. So again, the tactic we use to handle that kind of infrequent but really financially severe type of expense to a health plan is to transfer that risk. And so basically this is the 1% of your population that drives 50% of your costs, extended hospital stays, specialty drugs, things of that nature. They usually have 6 or 7 digit expenses bills submitted on the health plan, and are really grave situations for your health plan members and their families. You don't have to look too hard in the industry to find examples of this. We just had a drug come out. Our pharmaceutical industry just came out with this $2 million drug with a miraculous clinical outcome. It can actually, cure spinal muscular atrophy in babies, and that's just the latest in a series of specialty drugs that have come out. So, you're talking about picking a point at which you say, okay, as a self-funded employer, I've got to transfer this risk via, stop loss insurance, and that's the instrument that we deal in, and to transfer the risk of high claimants, that 1% or 2% of your population that drives 50% of the cost. And so we want to transfer that risk to a risk-bearing institution, and we think that having your bases completely covered in that quadrant is of the utmost importance to a self-funded plan. So, long answer to your.
Okay, so $2 million drug. Listen, I am super happy for the families that are able to utilize this, but a $2 million clip. I mean, you're talking significant money towards everybody else in the plan's cost, right? I mean, folks don't realize that, and there's a lot of other drugs that, like hemo and things of that nature. So when we enter the stealth stop loss ecosystem to address that $2 million clip, what actually happens through that system?
Yeah, so a lot. It all begins with that deep partnership, as we have, with you and your team there. You guys as a consultant really quarterback the health plan's overarching strategy, or as you put it earlier, caddy for them on the golf course. So right. It's really predicated on that partnership with you guys, understanding the objectives. And so together, we run a pretty comprehensive RFP process that puts our scale and scope of expertise to work to present that client's health plan's track record and go forward strategy to the stop loss markets in a way that, accentuates those great management efforts that we've all talked about, making the bull market case for that case, if you will, to the stop loss markets using data. So the process is really intensive, and we as an organization literally run thousands of these a year. We're national. We have offices in headquartered in Scottsdale. We have an office in Atlanta, Charleston, South Carolina, Dallas, Detroit, Northern California. So we run a lot of these in the country. And local market managed care dynamics can really vary, and they're always changing. So again, being national in scope and having the top tier talent in each of those markets, we feel like we keep a really good handle on local market dynamics to run RFPs, and always keeps us on our toes and working hard, which is how we like it. So as that bid process takes shape, and we've identified the best fit for the carrier and the plan to work together, we execute that final placement with the market that has shown the strongest value. And then the next step is, with that bid process complete, the next phases of our work began, and our team works with the carrier selected to ensure that the contracts are accurate. We ensure that data feeds between all the plan vendors, payers, networks, perhaps some, specialty, care that manages dialysis, wellness vendors, that all of the data feeds that are used to track the financials of the health plan are set up properly for tracking. We quarterback the NDAs and such, documents that are in place to make sure that data flows, because while, transparency is the utmost of importance, so is compliance. So you want those proper protection in NDAs. And then policies issued, and we actually perform all the premium management for our carrier partners as well. And perhaps most importantly, our claims team takes all the information during the plan year and manages the reimbursement process when one of the health plans has an event where that stop loss needs to be activated and a reimbursement's due. And so, although these should only probably occur somewhere between 2 and 5 times a year, the documentation process can be intense, particularly when these are, $1 million of bill charges by hospitals or more. And our claims team lives in this world every day, knows the nuances of the carrier partners, and really this pays dividends in the form of timely and accurate reimbursements to the self-funded health plans. And after all, that's the ultimate goal and the reason why stop-loss insurance exists. So then before you know it, we're back up for renewal, and our clients' plans are right back up at the plate for Mr. Market to evaluate every year, and we're already armed with the data that we need, which really can be substantial to run that annual bid process to a professional standard with maximum leverage to ensure we get the best value from the next at bat. So it really is a full cycle.
Okay, so if I'm understanding correctly, Stealth essentially functions as wing to wing, right? Best in class to shop the stop loss, right? And then helps our team coordinate everything from managing the annual bid process, selecting the best match from the top rated stop loss carriers in the U.S., verifying the contract terms that we all agree to, correct?
Yep, that's it.
Then also help us consult on the stop loss issues throughout the year and ensure that all claims are running on our track and reimbursement requests are complete. And they also serve a client's premium management facility no matter what carrier plan is selected, correct?
That's correct, Matt. That's correct.
All right. Let's focus on the carrier partners for a while. Can you talk about that market? The size, stability, benefits it provides, the employer's plan, the forced shape, things of that nature.
Yeah, for sure. So the first thing I'll share is just a little bit of insight into the market size. Most industry folks estimate the size of the U.S. stop loss market at somewhere around $18 or $20 billion, and that's grown, and we think it'll continue to grow just due to the increased prevalence of self-funding in the smaller, mid, and of course the large employer base. It's just getting more common for employers to finance their plan that way. So that $20 billion sounds big, kind of until you compare it to the entire value of the U.S. commercial healthcare market at like over $1 trillion. So you can see the value of the hedge instrument relative to the whole thing is still really small. So we think this is going to grow. And so within that $20 billion, say, you see a really diverse set of stop loss carriers, whose logos are kind of displayed here on the page, and that's that Stealth ecosystem of carrier partners. Each of these guys are direct writers. They are, quality carriers. We trust them. All of them, do this as a major business and with some scale, and they each have their own appetites. And for self-funded employers to, have a rich market to transfer large claim risk into, we think that's a good thing. We think that for, this and for really most any market for anything, as our panelists have said today, the greater number of legitimate options generally benefits the buyer. So, a few other fun facts about the stop loss market that we live in every day is basically 2/3 of the entire market trades on a January 1st effective date. So I'd wager a lot of the folks sitting on this call have January 1st effective dates that are self-funded. So, the market during August and November, as these bid processes are getting going, is pretty intense. It's really active. It's sort of similar to an accounting around tax time. And like if you're not already out to market for stop loss and you're a 1/1 and you don't have any plans to go in the next several weeks or so, you'll probably be bringing up the rear, which can have some downstream effects on setting budgets and contribution strategies and all these other things that are impacted by the financials of the health plan. So it's a really busy time. The second fun fact is that with these undeniable and continuous increases in the cost of medical services and drugs, the underwriting processes for all these stop loss carriers just has them scrutinizing employer health plan track records much, much harder. So you can expect any one of these carriers to have niches that they like and a much larger portion of the RFPs in the market that they will not offer proposals on. So we think this fact makes having efficient access to the whole market really key to ensure your clients are getting the best value. And that whole market, as we mentioned earlier, it is and will certainly continue to be dynamic. And if you could, Jenny, throw up that next slide. So you'll see on this slide with some examples of consolidation, contraction, and expansion that have happened with some big names in the industry over the past several years. So with this market as dynamic as it is, we at Stealth, being national and the largest, we take great care to have contacts at each one of these markets at every level and stay on top of what they want to write for us. So a little more industry insider knowledge. Jenny, if you'll scroll to that next slide or back to that's it. Thank you. Every one of these markets, when we approach them with a bid in any particular year, for one reason or another, we'll decline and offer a proposal at least half of the time. Okay, that ratio tends to jump around 60% at a time like this, at a really high volume time, such as this one. So again, just more reason to make sure you have top tier access to the whole market instead of honing in on maybe 2 or 3. Take advantage of the rich options that are out there with some major good carrier partners that are that serve this market. And I will say lastly and most critically, to echo everything the folks on the panel have said today, is that getting the best terms from every one of these markets is highly dependent on your plan and your consultant team having access to detailed claim data. Our mantra at Stealth is that, complete data is our currency that we use to the market. And, so nothing limits your options more than going to market without any currency. So you should think of information as currency in this market if you're a self-funded employer. Or maybe more importantly, if you're a fully insured employer looking to go there, you want to have the currency to trade in this market. And that is information for us. So as an ERISA plan sponsor with a duty to plan participants or to your shareholders, if you have them, if you trade publicly, please, for the great good of everyone, please insist on access to detailed claims data for your benefits team, consultant team to make decisions. The results you'll have in the stop loss market and in your plan in general will be just orders of magnitude better if you come with the data. If you go to market with subpar data, you really should expect not a good result in terms of numerous options. So I know that point's been made by our panelists, and we make it in the market every day, but there are forces in this market that are against it. We'll just say that.
Wow, it's a lot of takeaways in this market. Around 2/3 of all the transactions that would occur this year for January taking place. I know you were in our office the other day, and we have so many things that you're working on right now. We appreciate it. And you said Data is our currency to successful trade the market. This is a really big one in an era where transparency into the health plan spend, like you have in almost every other major line item as a company budget, should be a priority. I mean, for everybody. I mean, especially, you know, working with you, it's great because you understand the transparency model. You understand talking through how important these strategies are. And with a, you know, becoming such a budget item for so many companies, it is such a huge spend. And you guys get it. And having those discussions well in advance is so critical. Also within the stealth ecosystem that our clients can take, you know, they can have their cake and eat it too, with maximized options from the high end of the market, consistent process runs with specialized resources dedicated in every cycle of the plan year, and managing the risk transfer instrument for their health plan. I mean, you guys do it all.
Yeah, we live in that world, so we do, man.
Well, I tell you what, we greatly appreciate you being on here. We appreciate your partnership. Appreciate you educating everybody on the phone. I know everyone's like, oh, it's just a stop loss. Yeah, not really. You know, so once again, any closing remarks? Greatly appreciate you being here.
Yeah, we definitely appreciate the opportunity, Matt, and thanks to all the other panelists, carriers, and to the attendees for their attention today. And let's do another one soon, maybe January 2020 when we come back up for air.
I know. Well, Jay, thank you so much. You can take off right now, and I'll just wrap it up real quick. Thanks again. Just a couple final closing remarks. I know this is so difficult to put the time aside. We greatly appreciate everybody having the opportunity to spend with us. 2 hours is a lot, and we want to thank you so much. I know it's a lot of information, and if there's something that sparked an interest and you want to reach out to Jenny, we are absolutely more than happy to talk with anybody about any situation, your what ifs, send them all. We're here to make sure that everybody understands. We can help any organization. Our team here at IOA is phenomenal. Put them against everybody. You know, we have so many great opportunities to bring solutions. This is just 4 right off the top. And we picked these 4 just because they are so innovative and they're so transparent. And that's how we live our life here. You know, I have been in the business for 27 years, but I've been here at IOA for 15. And this is the mantra we live by. You know, I love my staff. I take care of them. I love being here. And we just greatly appreciate the opportunity and thank all of you for spending this time. This is the first of 4 segments. Each segment we might have the same group come on and we'll just talk about something different, something maybe a little bit more in the weeds. And if you have questions and you want to forward those to us so we can be prepared to answer those questions, by all means, please reach out to Jenny. The next seminar will be in November. Once again, it's going to be a 4-piece set. And thank you so much for your attendance, and we look forward to talking to everybody soon. Thank you very much.
Matt, thank you so much. You guys did an amazing job.